Hi everyone, this is Mrs. Rajalakshmi Murthy. Today we are going to discuss about organization of NICU. So first let I clear the topic first. I hope you all very well know about NICU, that is a neonatal intensive care unit. Similarly NICU there will be PICU, that is a pediatric intensive care unit. Short form we can say NICU and PICU. If you are telling NICU and PICU, you can able to easily remember uh, NICU. Okay, for this video, we are going to discuss about organization of NICU. What is meant by organization? So, organization of NICU means in the NICU how it is structured, how it is formulated, what is the location, how much square feet, yeah, how much square feet area it is built up. Then. So what is the staffing pattern? What is the equipment used in the NICU? What is the ratio of the staff nurse and patients ratio? So everything we will be discussed in the organization of NICU. Okay, clear? Next, please. So in NICU, which type of baby will be admitted? In NICU, soon after delivery, if the baby is having any medically unstable, means if the baby is developed any birth asphyxia or meconium strained aspiration or preterm baby or PROM, that is a premature rupture of membrane. So this type of baby or the baby is having any surgically complicated conditions, means cleft lip, cleft to palate. For this type of babies will be admitted in the NICU. So inside the NICU, what will be the treatment? That is a neonatal intensive care unit. It's similarly like intensive care unit for the adult. For adult in intensive care unit, what is the care they will be provided? Mostly highly risky patient will be admitted into the NICU. ICU. The same like that in NICU. The highly risky conditions baby will be admitted in the NICU. Mostly the baby will be in the preterm with the low birth weight baby. Preterm with the birth weight is very low, like below 2000 gram till to 500 gram. So that type of baby will be admitted into the NICU, and also the baby is in there. They will be provided continuous, highly quality, skilled nursing care to the neonatal. Continuous nursing care they will be provided along with the monitor of equipments like ventilators or CPAP, uh, any infusion pump, syringe pump, or any blood transfusions. So blood transfusion or any other transfusions. So this type of baby will be admitted into the NICU, and they will provide the treatment like high quality skilled care to the critically ill units by offering facilities for continuous clinical, biomedical and radiological monitoring and use of life support system. So once the baby has regained the weight, until the neonate has to be admitted into the NICU, there they will maintain thermoregulation, maintain their temperature level, then uh, aseptic technique to prevent infection. Then nutritional status, if the baby don't have any sign, preterm baby and all, they don't have sucking reflex, for that type of baby they will give a gavage feeding. So the care it will be provided into the NICU like this only. Next please. So what is the definition of NICU? Newborn or neonatal intensive care unit, an intensive care unit designed for premature and ill newborn babies. That is, the NICU is designed for to taking care of premature and ill newborns. Ill newborns means the baby is having some mild or major illnesses. Mild illness like it is a preterm baby. The birth weight is 2000 gram and above. The gestation week is 36 to 37 weeks of gestation, or any delivery complications like during intranatal period the baby is born with forceps delivery, any slight abrasions or low ABCA score, these babies and all admitted into the NICU for major cases like cleft lip, cleft palate, or any cardiac diseases, or any respiratory distress syndrome. So this type of baby will then very low birth weight baby. Um, this type of baby will be admitted into the NICU and taken care of in NICU. Next, please. So next one is aims of organizing NICU. What is the aim? The main aim is to reduce the mortality and morbidity of the neonate. See, mortality and morbidity you all know very well. Mortality means that is death rate. Morbidity means disease rate. Uh, for reducing the neonatal mortality uh, and improving the quality of life among the survivors. Next, please. What is the objectives? First one is to save the life of sick newborn. Uh, Here they are saving this life of sick newborn. Then to prevent damage in infants with problem at birth and also reduce the morbidity in later life. Means morbidity means disease rate if the baby is born with 36 or 35 weeks of gestation or very low birth weight baby. In future the baby will develop some other disease conditions for like IUG or intrauterine growth retardation. So this type of baby in future they can get some other disease conditions. To reduce that one, to prevent that morbidity rate in the future life, they are taking care in the NICU. Then to monitor high risk newborns so as to reduce the mortality and morbidity in these babies. So mainly the main aim and objective is to reduce the mortality and morbidity rate of neonates. Next. So in newborn there are three levels of care will be provided in the NICU. So the first level is mild one care. Mild one care, there is no that much care needed, only they can give a minimal care. In this type of baby will be born with more than 2000 gram weight, then gestational age is 37 weeks, means 36 to 37 weeks of gestation the baby has born. So this type of baby, the care, mild care will be provided by the mother under the supervision of health professional. The nurse or the doctor's neonatologist advise the mother to take care of the baby. The baby has to be kept in NICU for the observational purpose for 2 or 3 days. It depends upon the neonate condition. This baby, this care can be includes care of delivery, provision of warmth, maintenance of asepsis, and promotion of breastfeeding. So, what type of care instructed to the mother means mainly first to promote breastfeeding. Breastfeeding has to the mother has to be given for every 2 hours. Then maintain proper aseptic technique and to maintain the temperature of the baby. So this care will be provided by mother under the supervision of healthcare professional. You will have a doubt when the baby is admitted in the NICU, how the mother is entered into the NICU, give the feeding and how to maintain the temperature. So like this type of doubt you will have. So that I will explain to you. If the baby is admitted into the NICU for observational purpose, along with the NICU, there will be the room available. In that room, the mother will enter and the NICU sister will give the baby to feed the baby. Uh, so in that rooming in, there will be 2 or 3 type of cot available. the mother sit and give a feed to the baby. So there, when the mother has touching the baby, before that she has to hand wash, she has to maintain proper aseptic technique, then she has to give a breastfeed to the baby, then hand over to the neonatal sister. So like that the mother will enter into the NICU and give the feedings, then she will be back to the labor room. Okay, next. So level 2 care is required for 10 to 15% of newborn uh, in the neonate. Then this type of care, what they will do, they will give a resistation technique. The baby is having my sickness, the baby can't able to breathe, or very low birth weight baby, there is no lung maturity, so this type of conditions they can go for resuscitation. Then maintenance of thermoneutral temperature, intravenous infusion, gavage feeding, phototherapy, and exchange of transmission. In level 2 uh, care, they will provide this type of care inside the NICU. Okay, so in level 2, the birth weight is 1500 gram to 1800 gram, and the gestation weeks is 32 to 36 weeks of gestation. The baby is born like this means the baby require level 2 type of care. Okay, next please. In level 3 the baby has born less than 1500 gram and having the gestational age, that is the weeks of gestation is below 32 weeks of gestation. This type of baby required level 3 care. In that care, the baby has treated with the ventilator, special intensive neonatal care unit. The 3 to 5 percentage of babies required this type of care in the NICU. This is the level 3 care. Next, please. Then basic facilities. Inside the NICU, there will be the basic facilities. What are they? First one is adequate space. The NICU should have adequate space for each babies and to walk for staff members. So space. Enough space is needed. Then availability of running water, the 24 hours the water will be available in the NICU. Then centralized oxygen and suction facilities will be needed. Then maintenance of thermoneutral environment. Thermoneutral environment means the baby could have maintain some of the temperature inside the NICU, because inside the womb the temperature is very when compared to out of the womb. So the surrounding the external environment, to compare this one to the baby's environment, the temperature has to be maintained into the NICU. Next one, availability of plenty of linen and disposables, means plenty of linens and disposables needed to do any procedures, any IV line started or any other feeding has started. Also for the procedure, they need plenty of linens. Then facilities for availability of common neonatal problems. If the baby is having mild neonatal issues, that will be rectified in there itself, inside the NICU itself. Next, what is the components to organizing the NICU? The first one is physical facilities. NICU, how it is structured. So based on these things, physical facilities. In the physical facilities, what is the location? What is the square feet area? So everything will be coming under the physical facilities. Then personnel, that is the staffing pattern inside the NICU. Then the equipments which is used in the NICU. Then laboratory facilities like blood test or hemoglobin level. Inside the NICU, there will be the laboratory facilities. Then procedural manual to do procedures or shifting to the newborn. Transport of sick infants, cooperation between the obstetrician and neonatologist. So these are all the components we will be discussed one by one detail in the further slides. So NICU settings will be like this only. Uh, so what is that? This one. Hope you all, everyone gone posting to the NIC department. If you are posted in the labor room, not only in the NIC, if you are posted in the labor room, in labor room also there will be the warmer. So soon after delivery, the baby has kept in the warmer. In that warmer only, the pediatrician assesses the baby soon after delivery to assess the Apgar score. So before that you should know how to operate this warmer, what is the temperature, how it is maintained, so what all the things kept in the warmer. So everything you have to know when you are going to the clinicals, or if you don't know also, when you are enter into the labor room, you just, if there is no cases, first you observe all the equipments which is inside the labor room or NICU. In labor room, always if the hospital is well reputed, well equipped, in labor room always the one or two warmer will be present in the labor room. So you go and see everything. Okay, next please. Next one is the physical. First one, physical facilities. In the physical facilities, first location. The location always the NICU is situated near to the labor room. There will be the connection between the labor room and NICU. Then space. The how much space is required, that I will discuss in the further slide. Then floor plan. We need. The place where it is exactly based on the floor plan. If the doctor is coming from out of the hospital, they can understand. Then lighting facilities, environmental temperature and humidity, communication system means that is the intercom and phone facilities which is inside the NICU with the mild ringtone they are they have to use. Then handling social contact, electrical outlet, ventilation, acoustic characteristics means the noise has to be maintained into the NICU. How much? So that is the acoustic characteristics. Okay. Next, please. So location I already told you, it is always present near to the labor room. Separate staff. Labor room is having the separate staff. Then NICU is having the separate staff. The neonatal perinatal services separate. Floors. The neonatal should not situated in the top floor, so it is always present near to the labor room. Labor room always near to the ground floor. Then our outbound babies also each easily accessible to get the admission from the NICU. Next, it is not on the top floor. Next, please. So the space is required for each infant. The minimum area is 100 square feet or 10 square meter. The space for promotion of breastfeeding. So that is, I already told you, rooming in room has to be provided for mother to give a breastfeed to the neonate. Okay, next please. 500 to 600 grass square feet per bed is required. Then space including patient care area, storage area for doctors, nurses, station area, then office area, laboratory area, space for families. For everything, the space has to be provided in the NICU. There will be the 6 feet gap between one incubator to other incubator for adequate circulation. The nurses has to walk in between the two incubators or do some procedures. Because of that reason, they have to keep 6 feet gap between two incubators. Okay, next please. Then floor plan. Floor plan I already told you, when the floor plan always be present inside the NIC. Based on the floor plan, the doctors has to be identify the cases. The wall should be identify the places. The wall should be made of washable glass tiles and windows should have 2 layers of glass panels. Inside the NICU there will be the white color glassed tiles. Why they have kept like this means because of easily cleaning purpose. Then wash basin always present with the elbow or floor operated taps facilities because what is the technique they are following in the OT operation theater. The same technique will be followed in the NICU when the pediatrician or nurses or out any family members will enter into. Family members will not allow to inside the NICU, but if the doctor is coming from out of the hospital, they have to wash their hands, then wear the mask and apron, gown, everything. After that, only they are allowed to the NICU because the neonates is highly risky condition to get the infection. Because of that reason, they are doing the techniques which they followed like OT. Then the door should be provided with the automatic door closers. Okay, then isolation rooms also needed if the baby is delivered from the mother of any highly infectious disease like HIV, syphilis, or hepatitis. So this type of baby will be treated in the isolation room. Okay, next please. So ventilation means that is a air effective air cross ventilation is needed into the NICU. Not only for that, then centralized AC has to be maintained to prevent infection. Next, lighting. The lighting usually the light has to be illuminated and painted in the white wall to observe the colors. To to reduce the color observation. The lighting arrangement should provide a uniform shadow-free illumination of 100-foot candles at the baby levels. Inside the NICU, they have to maintain proper light settings. Next, please. The environmental temperature and humidity. Inside the NICU, they have to maintain certain type of temperatures and humidity to the newborns because out of the womb there will be the external environment the neonate cannot able to adapt. So because of that reason, they have to maintain temperature inside the NICU. Then humidity means inside the air there will be the moisturized level. So that also they will be maintained in the NICU. Usually the inside the NICU the temperature level is 28 plus or minus 2 degree Celsius. I already told you this is a warmer. In down they will kept some of the suction catheter, syringes, then vitamin K injection. The baby required some oxygen cannulation. So everything they will be kept in the warmer tray. So this is the bed. Here the switch will be available. See, this isn't a very easy to operate. Once the baby has delivered, the baby has to be kept in the this warmer. Then this is the to set the temperature level mainly 36.5 to 37.5. They have to set the temperature for the baby. Once you have set, you can able to feel the temperature. The heat rays will be coming from this light. Based on that, you have to adjust here the temperature. Okay, when you are keeping your palm of your hand over the in between this place, you can able to feel the uh, hotness in the air. So based on that, you have to adjust the temperature. The baby required warmth soon after delivery. Okay, next the humidity level above the 50 percentage of needed in the NICU. Portable radiant heater or infrared lamp can be used to maintain the environmental temperature in the NICU. Then communication system, I already told you inside the campus there will be the intercom or landline phone to contact the neonatologist or any other personnel. Next, electrical outlet. Electrical outlet is compulsory needed. Along with that, there is a power backup to maintain the power inside the NICU because if the baby is in ventilatory support or in the infusion pump or any other electronic monitor, so during that conditions to prevent disconnecting the process, because of that reason, that is a UPS system will be attached into the NICU. Next, please. Next to the staff pattern. The staffs who are all inside to the NICU, that is mainly neonatologist. Neonatologist means the physician mainly taking care of neonate babies. Then one neonatal physician require for 6 to 10 patients. Then one resident doctor should be present in the unit around the clock. In 24 hours, the residential doctors, that is the duty doctors, will be present in the NICU. Then anesthetist pediatric surgeon also present into the NICU to taking care of the baby, or otherwise they will if any emergency, then neonatologist or staff nurse will call them for procedures. Okay, next please. Next one is nurses. What is the ratios for the nurses? Patient ratio is 1:1 maintained throughout the day. If the baby is having highly sick for in the severe condition, level 3 care is needed. So during that time, the patient ratio is 1:1, one baby and one staff nurse. Night is essential for the babies and multi-system support, including the ventilatory therapy. For special care, neonatal unit and intermediate care, nurses patient ratio is 1:3 is the ideal. For second level or the baby is required mild level during that condition, 1:3 ratio, that is a one nurse 3 patient, 1:5 per shift is manageable condition. The head nurse is the overall in charge into the NICU. Next please. So in addition, level 2 care, that is a tertiary care require staff nurse needed to be trained in handling equipment. Inside the NICU, the nurse which is posted in the NICU highly qualified, highly skilled to use the NICU equipment inside the campus. Use how to use of ventilators entirely different from the adult to neonate. So the nurses should know how to use handling the equipment, use of ventilators, and initiation of life support, like how to use the ambu bag to the baby. So everything has to be different when compared to the adult to neonate. So these things the nurses has to be trained properly and appointed into the NICU. Okay. Then arterial sampling, endotracheal intubation, how to set the tray, so medications, so everything. Medications will be prescribed by the physician only, but the nurses has to know use of all the equipments inside the NICU. Okay, then they must have a minimum of 3 years work experience in the special care of neonatal intensive care unit. Then other staffs required in the NICU, mainly the respiratory therapist, laboratory technician, biomedical engineer, public health nurse, and social health workers. Then disposable articles required for NICU. Disposable means that is a use and throw. The articles which is required for NICU from the IV set to extension tubing till the instrument they are using the disposable, they will not reuse again. So that type of items they can consider as a disposable. That is IV catheter, IV set, bacterial filters, microburette set, endotracheal tubes, syringes, needles, then suction tube, suction apparatus, gavage feeding tube. So everything is the disposable articles. Baby care area. In the baby care area there has to be examination area for the neonates, then the area to breastfeed the baby and expression of the breast milk of mother, then nurses station, and charting area, then areas and rooms for the inborn means that is a newborn baby. So this is the area which will be provided by the NICU. Next, hand washing and gowning. It will be situated in front of the NICU, that is located at the entrance. Once the neonatologist or out of the hospital, some health professional is coming from out of the hospitals or neonatologist, they have to wash their hands. Then self-closing door. They can't able, they should not touch the door. Automatically, if the person is enter, the door has to be open. That door we can call it as self-closing door. Next, once they enter into the NIC, before that they have to wear gown, mask, then hand glove, then shoe cover. So everything has to be kept at the entrance. It's like NICU, it's like ICU, they have to keep all the thing in the entrance. Next, personal. The person which is inside the NICU, that is a skilled nurse, neonatologist, lab technician, biomedical technician. Biomedical technician means that is a uh, to check the blood investigation. Respiratory therapist, then pathologist. So these are all the personals available into the NICU. Next, equipments. The equipments which is inside the NICU, what they have used mainly in the warmer. Without warmer, there is no NICU. So this is warmer, radiant warmer. It depends upon the patient conditions. They have to use a warmer, radiant warmer. Phototherapy. Phototherapy used for the condition of physiological jaundice. Sometimes if the baby is having pathological jaundice, so that baby also keep it in the phototherapy. Next, oxygen hood. The baby will not keep the oxygen cannula. Because of that reason, they are keeping the baby in the oxygen hood. Inside the oxygen cannula has they inserted. Through that, the oxygen is going to the baby. So this oxygen hood, inside the oxygen hood, there will be the oxygen circulation, so the baby can able to inhale and exhale. Next, weighing machine. Then small wall mounted suction apparatus and oxygen apparatus will be there. Next, then ventilators, infusion pumps. This is a infusion pump. When you are going to the clinicals in the NICU posting, you should learn all the things which is present inside the NICU. This is the infusion pump. Here they have to set the rate per minute or per hours. So IV set infusion pump is different for the NICU. So everything you have to learn. This is the ambu bag. Ambu bag size also differ from adult to neonate. This is a syringe pump. So here also the setting will be there. The senior staff is available in the NICU. You request them to learn all the instrument. Okay. Next one is laboratory facilities. Well equipped hospital means inside the NICU there will be the laboratory facilities. Then transport of sick infant and procedure for mammals. So everything is best attached into the NICU. Then the cooperation always needed between the neonatologist and obstetrician to taking care of the baby, because if the baby is having some congenital anomalies or any some medically issues, so during that conditions the neonatologist and obstetricians discussed about the perinatal history of the baby. Perinatal means that is antenatal, intranatal and postnatal. So three things we can consider. uh, so they have to discuss and give a treatment based on the history also. Then promotion of feeding with the human milk, supervised care of low birth weight baby. Low birth weight baby, It's a one type of condition that I will be making other video. Next, please. The type of baby also low birth weight baby is mainly admitted into the NICU to regain the birth weight. Once the birth weight is reached, the baby is handed over to the family member's mother. Then management of nursing care. So this is important into the NICU. First, they have to assess the baby. That is the assessment, monitoring physiological data. Physiological data they have to monitor, like vital signs. Then safety measures. The baby has to be maintained safely. Then respiratory support, thermoregulation, protection from infection, then hydration status of the baby, nutrition, feeding resistant, skin care. So everything will be taking care of the nurse. Then medications, administration of medications, it depends upon the physician order. Then developmental outcomes. If the nurse working in the NSU, they have to monitor all the things, baby's hydration level, then baby's temperature, baby's feeding process. If the baby is taking palatal feeding, they can give a palatal feeding, or otherwise, if the baby is having the in-stream feeding, gavage feeding, that they will provide. It depends upon the doctor's prescription. Then uh, baby's neurological development. So everything will be monitored into the continuing nursing care. Uh, if the baby is alright when compared to admission, now the baby is having active, then having the sucking reflex, then grasping power. So everything will be monitored into the nursing care. Once the baby is recovered, so the baby plan to discharge to the home. Okay, next please. If there is any neonatal loss, so everything will be monitored in the NICU. So up to this, we have understood about organization of NICU. Organization of NICU means NICU, how it is structured, what is the square feet area, where it is located, what is the staffing personnel, what is the care will be provided into the NICU. Everything will be seen in the organization of NICU. So that is the organization of NICU. If the questions are coming from the university examination, you have to list down all the things from the 15 mark questions. For the 15 mark questions, you have to write all the things. For the short note means only you have to mention the title. Okay. If you have any doubt, please put it into the command. Okay. Thank you. Read smartly, learn smartly to become a smart nurse. Thank you.